So lots of concerns about every aspect of life. And to answer some of your worries, we're joined by Sarah Stewart-Brown, who's a Professor of Public Health. Professor Brown, thank you for joining us. Now, it is the only thing that people are talking about, and given the restrictions that were announced yesterday, many people are questioning if they go far enough. Do they?
I think they certainly do at the moment, and I'm sure we can rely on the government and the Chief Medical Officer to be balancing sensible advice with the problems that can arise if we go overboard on them, and they were very clear on those facts. So it's great that they are thinking about these things and advising us. But the problem is the degree of panic. I really like that lady from Brussels. This is not a particularly dangerous bug. Well, the problem is, because none of us have got immunity to it, many people may get the illness at the same time, and then it's difficult for businesses and for hospitals and people to cope. But it's not particularly dangerous, and we also have some control over our immune systems, so that the extent to which we get into a panic and we get very anxious and we start rushing around doing things that we don't usually do will impact on our capacity to fight the virus ourselves. So by creating panic over something that's really not very dangerous, we are making our chances of getting ill worse and more likely.
OK, well, let's just go through a few of people's concerns, sort of listening very clearly to what you said there. What about schools? We've seen schools closed in other countries, not closed here at the moment. I presume you're going to say that's the right thing to do because that's the scientific advice. Do you expect them to be closed in the next few weeks, and do you understand why people would be worried about that?
I can see how it caused major disruption, and I can also see how people might be worried. But all the evidence is this is a very mild infection in children, that they are least badly affected. So the issue with the children is spreading it to other people rather than what's going to happen to them. Children in schools get bugs from each other all the time, and we look after them at home and look after them till they're well enough to go back again. So I'm going to keep my children at home to protect them. It's not grounded in any real sense, that.
However, Professor Brown, there is a huge concern about older people being at greater risk, and Boris Johnson did say yesterday that we may well lose our loved ones before their time. Now, that in itself is very scary. I'm worried about my parents, as Matt is. I'm sure lots of our viewers are. So how do we reassure them and also protect them?
Well, yes, I'm having to do a certain amount of reassuring of my children as well. One of the things, again, about our immune systems is that they respond very well to positive social support, to care, to feeling you're in the company of people who could look after you if you were ill, and isolating people and putting people in quarantine has the reverse effect. So the very process of isolation, the shutting down of lunch clubs and keeping people apart, is putting them more at risk from the point of view of their own immune systems. So there is a balancing act to be done here. And what the point the government was making was that we may need some of these precautions to come into line when the virus is at its most common. Not at its most virulent, but when it's at its highest level in the community. But to do it now and to think about people being on their own for that length of time is really not good for people. So we just need to be a bit more sensible about this and a bit less scared.